enter the room.
Hello. Hello.
Good day. Yes, hello.
Hello. Hello. I'm one of the doctor in the GP. Could you please confirm your full name and age?
Okay, doc. My name is Pat Smith. I'm 53 years old.
Right. I can see from my notes that you're here for your follow-up, right?
Yes, I was in the hospital about 6 weeks ago.
All right. Could you please give me a recap of why you got admitted 6 weeks ago?
So I was admitted to the hospital for cellulitis of my right leg, and I was
Mhm.
treated with IV antibiotics, and my leg is doing fine now.
I'm glad to hear that. Let me ask you a few questions in order to have a better overview. Is that right?
Yes, doc. So I just wanted to also let you know that during my stay,
Mm-hmm. Mm-hmm.
they found out that I have a high blood pressure, and they started
All
me
right.
on enalapril.
All right. All right. So, how are you feeling now?
My leg is totally fine, no issues
Mm-hmm.
there.
Mm-hmm.
But since my discharge, I've been
Mm-hmm.
having a severe cough. I honestly think it's from the enalapril, so I stopped
Mm-hmm.
taking it about 2 weeks ago.
All right. May I ask you why you think that that is the medication is the cause for your cough?
Well, dog, I was fine all along, of course,
Mm-hmm.
except for my leg. But
Mm-hmm.
ever since starting that enalapril, the cough was so
Mm-hmm.
bad. I didn't have
Mm-hmm.
any other symptoms, no breathlessness, no chest
Mm-hmm.
pain, and the cough
Mm-hmm.
was mostly dry.
Mm-hmm. Could you please say more about the cough? How often do you have this cough?
Well, during the time that I was taking enalapril, it was
Mm-hmm.
every day and it was quite
Mm-hmm.
severe.
Mm-hmm. Right. And did you notice that anything making the cough better or worse?
No, nothing made it worse, but I did notice that I got better once I stopped the enalapril.
Mm-hmm. All right. And did you had any other symptoms other than the cough, like any fever or flu-like symptoms?
No, none at all.
All right. And how do you feel after stopping the medication? Do you feel did your cough subsided?
Yes, the cough has subsided.
All right. So, apart from the cough, how's your health? Is everything going fine?
Yes, I'm generally okay.
All right. So, let me ask you some of your medical history. Have you been diagnosed with any other medical condition other than the hypertension and the cellulitis, which you were admitted?
Well, I'm actually a type 2 diabetic. Since
Mm-hmm.
the last 15 years, it's well
Mm-hmm.
controlled with my diet and my medications.
Mm-hmm. All right. So, let me know what medication are you taking for your diabetes?
I'm taking metformin twice a day.
Mm-hmm. Are you regular with your medication?
Yes, I am. I also take simvastatin. I take it
Mm-hmm.
in the morning and I don't have any issues there.
All right. Are you taking the simvastatin as prescribed regularly?
Well, I take it in the morning.
All right. All right. Okay. So, have you been diagnosed with any other medical condition other than this, which you may already mentioned?
No, nothing at all.
Are you taking any other medication other than the simvastatin and the one for hypertension?
No, just simvastatin and metformin, and then I
All
stopped the
right.
enalapril 2 weeks ago.
All right. And during your stay, during discharge, did they give you any antibiotics or any other medication?
No, I was adequately treated in the hospital.
All right. Do you have any allergies?
No, none that I know of.
All right. So, do you have any family history of any significant medical problems like heart diseases, diabetes, or any hypertension?
No, dog.
All right. Let me ask you some of your lifestyle questions. Do you smoke?
Well, I don't smoke.
Mm-hmm. All right. Do you drink alcohol?
Occasionally, but I try to limit myself.
All right. And are you physically active?
Well, I'm minimally active. I mostly live a sedentary lifestyle.
Mm-hmm. All right. And what about your diet? Do you follow a healthy diet?
Yes, it's balanced, but I do need
Mm-hmm.
some improvement in terms of reducing my salt and fat intake as I was advised.
Mm-hmm. All right. So, may I ask you what do you do for living?
I'm a photographer.
2 minutes remaining.
All right. Um, so, uh, uh, Mr. Pal, thank you for answering all these questions. Now, I'll be doing a physical examination. I'll be checking your vitals. I'll be doing a routine blood investigation.
Yes, that's okay.
All right. So, do you have any idea what's going on with you?
No, well, I think my medication might be the ones that are causing my issues. I'm not sure.
All right. From the history which you have given me, I'm suspecting that the cough which you had is a side effect of the medication which we gave you for your hypertension.
Okay.
Am I clear?
Yes,
All
you
right.
are.
Okay. So the medication which we gave has a side effect of causing this dry cough. So when we check your blood pressure, it is 150 95, which is a bit on the higher side. We want it less than 130 80. So it can be because of you stop the medication. Mm-hmm.
Okay.
Are you following?
Yes,
All right.
but dog, I
So
wouldn't want to go back on that pro.
can understand that it must be very difficult for you. That's all right. We'll be giving you another medication which will not cause the side effect. We'll be giving a group of medication on as ARB, like telmisartan or risnopril. I will confirm it, and we will give you that medication, and you have to take the medication as prescribed regularly. Is that
Okay,
okay?
dog. Yes, it's fine.
All right.
Move on to the next station.
Awesome, guys. Good job, good job. So, yes, so as you guys know, this is a counseling station.
Mm-hmm.
And so from your consultation, Dr. Farisha,
Mm-hmm.
what did you think the main issue was with this?
Yeah, it was the cough and medication.
But what was the issue? What is the worst? I mean, what is the main issue that would worry you?
The patients stop taking the medication, and it might cause something for the patient.
Absolutely. He stopped the
Yeah,
patient without any, what to say, doctor's advice. He stopped
yeah,
own. You have to highlight the fact that he did this and not
yes,
without any advice.
yes, yes.
Highlight the fact, were you asked to stop the medicine? Did anybody ask
Mhm.
you to stop the medicine? That's very important because
Okay.
and why is he doing that? He's saying it's cough.
Mm-hmm.
Next time you feel there is a problem with the medication, please do come back
Mm-hmm.
so that we can review it.
Yes,
Because
yes,
management over here, that is the biggest issue that you're trying to avoid.
yes,
Do you understand? Yeah.
yes, yes.
So whenever there is a conversation, always try to understand what is the main issue and what do I have to do in management for it to not happen again.
Mm-hmm.
So
Yes,
definitely that is one of the major things to cover in this case. But
yeah.
you very well identify that his blood pressure is high.
Mm.
You can also do a foot examination as well, since he came with cellulitis, a leg examination. I had that in my
Yeah.
examination.
Okay.
And thank you, Dr. Natasha. Yeah, usually statins are taken at night. It's not taken in the morning. I'm really sorry about that. I will be changing that. Yeah.
Okay.
Usually cholesterol metabolism happens at night usually, so yeah, you you have to give
Okay.
any of the statins at night. But yeah, definitely. Apart from that, let's talk about this case. So
Okay.
this is a little critical where this patient has come for a follow-up for his cellulitis of the foot,
Yes.
right? So Dr. Natasha was kind enough to give you the clue of the hypertension medication, but sometimes they may not give you that clue.
Okay.
For them, patient, they felt that this additional enalapril medication which is causing them cough, because apart from cough, there's nothing worrying them. They can't actually, as of now, the hypertension is subclinical. They can't feel any of this, hypertension signs. For them, the most pressing issue was the cough, and so once they stop the medication, the cough is gone and nothing else is bothering them. So they may not offer that information. You have to do your data gathering to understand that. So you
Okay.
ask about, can you tell me what happened in the last time's visit? So they'll talk about the IV, and then they can also say that, all right, was there anything else done for you? Then they may say that, yeah, they saw that I had a blood pressure on the higher side, so they gave me medication. And then you can go asking, all right, and are you taking the medication as prescribed? Like, no, a lot of cough, so I just stopped. Yeah, so then
Okay.
and that this is your case, because in the calendar information, it doesn't really give you much information. Cases can come like this, guys. Definitely, you need to do justice to your data gathering to get to know what the case is, right? Knowing that, now you understood that the case is about medication counseling, where you're supposed to advise them on how to take the medication and if there are any side effects to review the medication. So now you understood that the patient is having side effects. One important question to ask around this. What do you guys think? Anybody? Anyone? Were you explained about any of the side effects of this medication?
Yeah.
It's supposed to be, this was one of the side effects that were to be expected. Important question. Why is that important? Because, they don't know what to do when the side effect happens. Why you need to tell them? Even when you're giving ARV, you have to tell them the side effects of the ARV. If you don't know the side effects of ARV, you can always say that I will mention the side effects of ARV. I will be looking into my book and telling you the side effects of ARV. If you experience any of this, please come back to the hospital immediately rather than stop the medicine. Right?
Yes. Yes.
That is the main management here, because they are prematurely stopping the medication. You are not supposed to do that. And then you're supposed to explain them the complications of what can happen if the hypertension gets worse. Right? After
Yes.
to do this can happen. You have to show them that possibility. Right?
Yes. Yes.
That's important in this scenario. All right, let's quickly take a look at the performance. So now, were you able to mark? Dr. Sana? Yes, thank you so much. Cough was not explored. You need to understand a little bit more about the cough. Like, why is he having the cough? Was it any other organic cause that could be causing cough? Is he having any COPD, asthma symptoms? Right? Does he have any infection? Current leg condition was not discussed. That's very important, because what is the purpose of him coming for the follow-up? Is for the follow-up of the. But then Dr. Natasha mentioned that, yeah, my leg is fine. But even if the person does say the leg is fine, if the main consultation is for the follow-up for the leg cellulitis. So to examine the leg and make sure that it's fine. All right. Patient identifiers confirm full name and age, confirm reason for visit, follow-up after hospital stay for cellulitis, elicit details of previous hospital admission by asking what happened 6 weeks ago and what treatment she received for cellulitis, assess cough characteristics such as dry, time, and ask about associated red flags, symptoms like shortness of breath, fever, chest pain. Review full medical history, including type 2 diabetes, mellitus, and newly diagnosed hypertension, and confirm any other chronic conditions. Gather lifestyle information, diet, exercise, smoking status, alcohol intake. We're looking for any other contributing factors, that could aggravate condition, so that you can, because he already has cellulitis with diabetes. Is he good lifestyle for that? And then that he is also hypertensive. So think about the lifestyle aspects associated with that, risk factors, right? Partially covered, ask about new diagnosis of hypertension during hospital stay, review medication adherence, and inquire about missed doses, difficulty taking medications, or any over-the-counter remedies used. Conduct physical examination, findings, vitals, respiratory examination, leg examination, inspect for TVP, and explore current leg condition by asking about pain, redness, swelling, warmth is very important. What are the other causes of cough? Rule out other causes like asthma, GERD, infection by asking about wheezing, acid reflux, recent illness, or smoking. Yeah. Yes, lifestyle advice missed. All right. Explain cough diagnosis as a common side effect of NLRP due to the bradykinin buildup, irritating the lungs. You can talk about the bradykinin, but you can always say that this is one of the side effects, because of the medication. Discontinue and explain the need to stop it to prevent further discomfort from the dry cough. Initiate losartan, telmisartan. So any of the prills is ACE inhibitors. All the sartans are the ARBs, right? So you can say that we're going to initiate you on a new class of drugs called, ARBs, angiotensin receptor blockers. Initiate losartan 50 mg as an alternative antihypertensive and clearly explain how it works and its benefits. Also, since this is a side effect case, you have to explain the side effect of the medication that you're also giving, right? Either you can mention the side effects, or you can say that I'm going to be mentioning certain side effects, which I'm going to refer to my book and tell you. Yeah, if you don't know, that's all right. But you should know that you should be mentioning these things, right? Request pre-test, because even you're going to start a new medication, so you need to understand what are the tests to be given, right? I mean, what are the baseline tests you need to measure? Because ARVs actually cause a lot of liver dysfunction, but that's a rare side effect. It's not, but that's why you need to make sure to have a baseline LFT. And electrolyte causes hyperkalemia. Right. Otherwise, provide lifestyle advice, reduce fat and reduce salt and saturated fat intake, increase physical activity, manage stress, avoid alcohol excess, and quit smoking. Offer dietary support through a referral to a dietitian, and provide a written diet sheet tailored to diabetic and hypertensive needs. As I said, right, I think I'm taking in a lot of fat and salt. That was advised to me to stop. Yeah, so you can give them a little more nudge towards that side. Like, I can understand you're trying, but how about I give you some resources that can help you in this effort, right? Arrange follow-up in 2 weeks with blood tests to review medication effects, monitor side effects, and assess BP and renal function, right? Provide information materials like leaflets. Yeah. So these are the things that you can always do for all the cases, right? The safety netting, leaflets, pamphlets, and follow-up. So try to incorporate that in all your management. And interpersonal skill, involve the patient in decision-making regarding the treatment plan. So that is very important in this case, because he wants to know, if I'm going to be taking this other medication, will it cause me cough? If it's not cough, what can it cause me? Right, so definitely mention the side effects and make them aware of what to do if the side effects happen, right? That's very important. And offer reassurance and continuous support for managing blood pressure, provide reassurance and continuity. Example, we will keep a close eye on your progress and adjust things if needed. You're not alone in this. Yeah, that's that's some encouraging word to build confidence. But yes, good job, Doctor. This was great.